Hi, my name is Ann Izard. I'm one of the chiropractors here at Teamworks. I'm going to talk a little bit about the orthotics that we offer at the clinic here. Main goal of an orthotic is to provide some support and reduce some of the what we call biomechanical issues that we see with people's walking or running gait, to provide a little bit more support through the lower body. A lot of times we have patients that come in who have low back pain or pain in the lower body, and the orthotics can help and make a difference to the treatment plans that we're working through. So some of the conditions that I often prescribe orthotics for: plantar fasciitis across the bottom of the foot, that kind of aching pain, particularly across the heel as you get up in the morning. What's called metatarsalgia, which is pain for a little bit further forward on the bottom of the foot. Achilles tendonitis, irritation back here. Shin splints across the front of the shin here. Iliotibial band irritation here. Knee pain, both on the inside and the outside of the knee. And lower back pain. When we're deciding about orthotics, what we do is we take a look at the patient's gait. So I'm looking at you, in most cases, walking. We can also use a treadmill and do a bit of a running gait analysis as well. The two main areas that orthotics can help with are when I see someone whose foot does what's called overpronation. So it rolls in a little bit too much as you're walking through there. And that a lot of times puts strain on the inside of the knee here and can get a bit of a torque through the hip and low back. The other area we see it is with oversupination, which is pretty much the opposite, where the foot rolls out a little bit too much. In that case, there's a lot of times irritation across the side, the outside of the leg. There's also in that case less shock absorption through your foot when you're walking. So patients typically experience some shin splints, or not even shin splints necessarily, but shin pain across that area. For orthotics, when we see the oversupination, one of the things I make sure is that there's enough cushioning through the orthotic to make it more comfortable in the shoe. So if we look at this one here, here's a full-length version like this, and you can see that there's a bit of support on this side. It's pretty, comfortable, but a bit firm, which prevents the foot from rolling in this direction. Here's another one. It's a little smaller version because this can fit in a wider variety of shoes. I typically tell patients that we want to put them in the shoes that you're going to be wearing the most, or that you're on your feet in the most. The better the shoes, the better the orthotic's going to work with the shoes. So you do want something supportive. It is hard to put a good orthotic in a shoe that doesn't have much support. That being said, we want to make it work for you and what you're doing and what your lifestyle is. So we do have the shorter one obviously available for dress loafers or other things that we can that will fit this. When we do get orthotics, patients often ask, my feet going to get sore, or my legs going to get sore? There is a little bit of what we call a break-in period. So for the first few days, I suggest wearing it an hour a day and gradually increasing that time. You will sometimes get a little tension in the legs. Let us know if that happens. We can always do an appointment where we work through those tissues and make you more comfortable. Also know that is normal as you get used to the orthotics. If you have any questions about them, please let us know here at Teamworks. I look forward to seeing you soon.